Hi everyone and welcome. So in this video, I want to share how I manage and settle piriformis flare-ups quickly. So this is a topic that I get asked about a lot, and I wanted to share some tips, the things that I do personally, because I know it can benefit a lot of people, especially when dealing with piriformis syndrome, that nagging pain that sometimes comes out of nowhere. In the beginning of my journey with piriformis syndrome, it used to take me months to settle a flare-up, and one of the things that I used to do that I no longer do is to panic and to start trying so many different things all at once. So this is kind of the first tip I want to give you is to not panic. So if you are starting to feel that tightness in the piriformis, maybe you're experiencing a spasm, you're really worried that it's going to turn into a full flare-up. Remember not to start doing so many things at once. So this could look like a lot of stretching, a lot of therapies, adjustments. So just keep that in mind. Just be mindful of how you're feeling. I will be sharing some tips here and things that you can do in terms of releases, assessments, and things like that. This is what I personally do. So I no longer experience long flare-ups. They do happen once in a few years if I push myself. For example, my last flare-up was during a move. We had to drive for 24 hours twice when we were moving between cities, and I was just doing so many things and sitting for that long of a time, which triggered a piriformis flare-up for me, but I was able to settle it in a few days, and I did share a video on that. So I still do the exact same thing. I haven't had a flare-up since then, but every time I feel some tightness, because it does happen sometimes, if I feel a little bit of tightness in that area, this is what I do before it turns into a flare. Because before, it used to be that when I feel some tightness, I just start doing too much, and then I can make the pain worse. And I think that this is kind of what people do, the mistake that they make, and it just doesn't help, especially when you've been in pain for a long time and that area just becomes so sensitive to triggers. When I notice pain in the piriformis, usually it affects my right hip, so it could be your left hip. What I usually do is I just kind of take a step back, try to reassess everything. I always think about, okay, what have I been doing lately that could have contributed to this? Usually I would journal just activities that I've been doing, something that I've been doing too much of, too much sitting, too much driving, maybe too much standing. How has even like the level of stress, has there been an event lately that kind of been stressful to my nervous system, because that could affect your muscles. So I just take kind of an overview of and assess my recent days just to see what could have contributed to that. And sometimes you may have to go back 2 weeks, because it can take a while for the pain threshold to be reached. So just go back 2 weeks and see what had been going on in your life that could have contributed to that, in terms of physical things, in terms of mental things. I also do the assessments in the piriformis control program. I have shared some examples in video before. I do a few assessments to see if my knees are caving in when I'm squatting, if they're turning out when I'm squatting. And oftentimes, just a simple assessment is to just kind of balance on one leg for a little while and just kind of stay there and notice how your muscles are behaving. What's going on here? Where do you feel tightness first? Is it kind of in your lower back tightens up first? Is it more on the side? Are you feeling it more here? That really just gives you that first look into which muscles are tightening up that can cause that piriformis to start spasming. And I do the same thing on the other side. And when you're doing this standing balancing test, you may notice that you have more balance standing on one leg. So if you're balancing on this one leg, you may notice that you're kind of losing your balance more. Whereas if you're on the left leg, maybe you're more stable. So that's also another indication that could give you, okay, maybe I need to work more on this glute med on the right side. You can do glute med activation exercise and add one more set on this side. If you're losing your balance on both sides, that could also indicate core weakness. So I would highly recommend that you do some inner core activation exercises. When you work on these things, it takes the load off of the piriformis so that it's not constantly acting up, trying to compensate and help balance your hips and your lower back. I spend the next few days just minimizing flexion movements. So anything involving sitting, driving, where you have to have your hip flexed, I just minimize it. I don't eliminate it, but I try to minimize it as much as I can. So I would try to do work that doesn't involve sitting too much. Maybe I would elevate my desk and do my work standing, or I would try to do take more breaks and go for walks, like 10-minute walks, just to kind of break it up. And I just try to minimize driving as well. And if I have to drive, I always use my lumbar support. So this is just something that has worked for me. So minimizing all of those triggers that cause that piriformis to flare up. The next thing that I do is I do releases with the massage ball against the wall. And this release really helps to desensitize overactive muscles. And it's just going to help inhibit the piriformis if it is overactive. The other thing is it just helps to kind of release any tightness in the area. So I do this against the wall. You can do it lying down, but I do prefer to do it standing because you can control the pressure that way. And you can just press more when you need to and release when you need to, versus on the ground where all your weight is on you, is on that ball. So I kind of just work outside of that area inwards, just kind of massage gently, and I do no more than 1 to 2 minute max. You don't want to be overdoing it. And you can do this twice a day. In terms of releases, I don't usually release the glutes, as in sitting on the foam roller, mainly because for me personally, it just always made the pain worse. I do prefer the massage ball, but test it and see how your body responds to that. What I usually like to do is just placing the foam roller behind my back, and I just go release the thoracic area and the upper back, and I release the lats. So try to aim more towards that latissimus dorsi area, which really tightens up. And when it tightens up, it pulls the hips forward into that anterior pelvic tilt. So we can also exacerbate piriformis pain. Another thing that works is placing the foam roller underneath your hamstrings, kind of towards the outer area of your hamstrings. So you would have your leg pointed out instead of forward, like this. And then you can roll up and down. And then when you find a tender spot, you just want to pause there for a few seconds. And then you do the other side, of course. And then I also release the quads when I'm doing these releases. I find that releasing these muscles, it always takes the load off the piriformis. I never work on the piriformis directly with the foam roller. And again, this is totally based on my own experience with it, because it just always made the muscle spasm more. So test it. If it's not working for you, just stick to the massage ball, because I do think that it's a better approach. The next thing I focus on, again, as I mentioned earlier, is lumbar support. So if you have a lumbar support, make sure to use it all the time. If you don't, you can use a pillow, and then you just want to place it in this area here, especially if you have to be working. I always make sure to have my whole back supported like this, and this just adds so much support for the lumbar spine, and it will also minimize flexion of the lumbar spine and all of that tension that builds up in the QL area, so the side of the lower back, which can trigger a piriformis pain. I have found that this to be really helpful when experiencing a flare-up, because it makes it more comfortable to sit down and do your work without feeling that tension in the lower back and pelvis. Just make sure to always use the lumbar support even when you're sitting on your couch. Just have that pillow, thick pillow behind you, pushing against your lower back, just providing that stability and support, and make sure to relax as you do so. The goal is to avoid any additional pressure on the lumbar spine that could trigger more pain or that could cause more pain, especially if the piriformis pain is related to a disc herniation or any disc related issue. So this just really helps to minimize that. So something really important I wanted to add here, whenever I'm experiencing a flare-up of any kind, even like tightness in my shoulders, back pain that came out of nowhere, I always take that as an opportunity to kind of review and reset my nutrition as well. So when I'm having issues with inflammation or pain, I try to do like a week of detoxing, and I don't do anything harsh. So I usually just reduce sugars and starchy foods, and I would increase things like soups made with homemade bone broth, just organic meats. I always add more ginger and turmeric. So I would have turmeric tea and ginger instead of coffee. And I would just try to include more anti-inflammatory foods in my diet. So more vegetables, low starches. So I would avoid bread, rice, pasta, and I would try to include more ginger, turmeric, teas, stews, broth, things like that. So this just really helps your body reduce inflammation, or as you're healing. And I always found that it makes a difference in how I'm feeling. And so just give it a try. It doesn't have to be anything drastic, but when you're experiencing pain, maybe try to just eat a little bit healthier. Maybe try to include some soups and then add more ginger and turmeric in the soups. I have so many recipes on my channel, anti-inflammatory recipes, if you need some ideas. Some other extra helpful things that I do is I take longer warm showers. I find that heat works best for me when it comes to chronic flare-ups or pain than ice or cold therapy. So I would take longer shower, maybe just having the water a little bit hotter in that area and just kind of stay there for a little bit. Another thing you can do is to lie on the acupressure mat. So I do have an acupressure mat that really helps to relieve the pain, and it just helps you relax and sleep better. So it's just definitely something that I recommend if you can get it. And then of course, I also take magnesium before bed to help relax the muscles naturally. So increasing sleep and relaxation as much as you can. Another thing that I do before bed is I try to do some breathing meditations and some body scan meditations to release the pain and the tension from my body before I drift into sleep. And I do have some custom-made meditations in my program, Mind Body Healing. So I will leave the link to that below if you are interested in getting them. And by this time, I usually notice a huge improvement. So all the things that I'm doing is just kind of supporting my body to settle the pain. I'm not really doing too much in terms of adjustments, massages, things like that. The only therapy that has worked for me before when it comes to settling a flare-up or kind of helping me get there faster is dry needling. So because I was also diagnosed many years ago with spinal arthritis, which can cause a lot of tightness in the hips and pelvis, I do find sometimes that it's tough for me to release certain areas like the fascia in the lower back. So when I notice that I can't really get to certain areas, or it's just hard for me to release them, I will do 1 or 2 sessions of dry needling. That's like when I'm really desperate. And it usually helps to kind of release that. It's just that final step to help me release tightness in the QL or in that fascia in the lower back. Sometimes also I do it on the TFL. It's not something that I do regularly, so maybe once a year, once every 2 years, I'll do 1 or 2 sessions because I do find it helpful. The assessments to determine if the piriformis is tight or weak, and also to determine if there's any other imbalances causing piriformis syndrome, especially if it hasn't gone away for many years. All the assessments are inside the Piriformis Control Program. So I designed all the assessments for you so you can go through them quickly. And there's also corrective exercise plans to help you correct these imbalances. So I hope today's video has been helpful. And if you have any follow-up questions, let me know in the comments.